Dear, well, how are you? Welcome back to our Space Health and Wellness. Today I wanted to talk about a topic that I think is tremendously important, which is the topic of pelvic floor exercises, the so called Kegel exercises, for the topic of fundamentally for the recovery of urine loss control, either in male patients or in female patients. The Kegel exercises are named after Kegel. He was a gynecologist, coincidentally from the University of Southern California where I work, who many years ago described these exercises to rehabilitate the pelvic floor muscles. These exercises basically have to do with improving urinary control, and it has also been suggested that they can improve sexual performance somewhat, not by developing an erection as such, but by making it last longer and be of better quality. However, the evidence for these exercises is basically for better urinary control. And urine loss, male or female urinary incontinence, let's focus initially on the male. Fundamentally, it can be lost or it can be compromised abruptly, particularly after prostate surgeries, or it can occur chronically as we age. It is estimated that a significant proportion of the population will require the use of diapers as the sphincter weakens. Therefore, it is very important. This is an important health problem, and you can see the number of diaper devices, protectors for urinary incontinence, because it is also an issue that does not distinguish social status or class or anything, because any patient who has undergone prostate surgery, either for cancer or benign surgery, can have temporary urinary loss, and in some cases it could be very long lasting, and this definitely affects the quality of life. There are reports that even patients operated on for prostate cancer 1 year after surgery, 20 or 30% are still using some type of protection because they still have urine leakage. So it is very important to start doing pelvic floor exercises as early as possible, even before the surgery, to help strengthen these muscles so that the recovery is as fast as possible, especially since it has been shown that the faster you do it, the better the chance of recovering urine control, and not to start doing the exercises when you already have a year with all these muscles affected and which are not contracting adequately. These exercises are primarily pelvic floor contractions. And you have to train the patient to recognize which muscle group to contract. Many times you tell him to do the exercises and he contracts his throat or he contracts his abdomen and does not really contract the perineal muscles. These muscles are intertwined with the muscles that are around the anal sphincter. And many times when they do the contraction of these muscles, they strengthen both epentherian systems. The exercise basically is that we tell the patient sometimes to sit on a surface, on a chair, initially on a surface, a flat chair, a firm chair, no pillow, no cushions, so that he can feel how it lifts up when he contracts it. This is an exercise that normally no one should notice that he is doing it, because it is internal muscles that are contracting, not that he is contracting the throat or the thorax, because what he is contracting are the muscles that are at the base of the pelvis. It is like when the patient feels that she is going to release a gas or wants to stop or contain the gas from coming out or wants to stop or avoid the loss of urine. When he does this exercise, he is contracting the sphincter. Sometimes we also tell the patient to feel as if he wants to lift the penis or to try to contract the scrotum so that he feels the testicles rising. That is when he is doing the perineal contraction exercise. So basically it is that we tell him he can do it lying down, he can do it sitting down, he can do it standing up, but basically he has to feel that sensation. When he contracts the pelvic floor, it is as if he wants to prevent gas from leaking, or he wants to prevent urine from coming out, or he wants to prevent urine from coming out, or he wants to feel like he is moving the penis, or he wants to lift the scrotum. These are the exercises that we ask him to do in order to do the suspension, and this exercise he does in the form of fast contractions or slow contractions. Fast is when we tell him to contract and then relax, or when we tell him to contract and count down from 1, get to 10 if possible, hold the contraction and then relax. These fast or slow exercises we ask him to do repeatedly, to do these exercises at least 3 to 4 times a day, breakfast, lunch, snack and dinner, especially finding a suitable area to do it, and repeating this exercise 10 to 15 times. That is, if he does 15 repetitions and does it 4 times, he repeats these exercises at least 60 times a day. And the patient will notice an improvement in urine leakage, usually within 4 to 6 weeks of doing these exercises. Very important, the recovery is not immediate. The recovery is generally intermittent and oscillates towards improvement. There are days when it is better. The next day it may get a little worse, but when you realize throughout the week that there was an important improvement, because the curve shows in what way it is improving. It is very important that in the meantime, while he is losing urine, he will of course use a diaper, an adequate diaper that retains the amount of urine he is losing, because sometimes they are not adequate, so he needs to change it. He needs to add additional towels to be able to manage the loss of urine. Initially, the patient begins to regain his continence during the night. He is able to get up and we tell him to hold on until he gets to the bathroom, and then he begins to regain his daytime continence, and after he has regained his daytime continence, he begins to regain his daytime continence, but partially. That is, he manages to go to the bathroom to urinate, but in between, each time he goes to the bathroom, he also has leaks in the diaper. And an exercise we ask you to do is that during 1 day a week, the day he wants, if he wants on Sundays when he is at home, he should try to quantify. Take a glass that has a perfect amount of those used for cooking, that has the amount of milliliters that he ingests. And every time he goes to drink water, coffee, or any liquid, take a sheet of paper and write down the time and the day on Sunday, what time he drank water, how much he drank. Write down the amount of water he drinks or any liquid he drinks during that day of the week that he chooses. Also, if he manages to urinate already, part in the toilet and part in the diaper, every time he goes to urinate in a collector that also has the numbers perfectly to know how much he is urinating every time he urinates. Then go to the paper and write down at 10 o'clock in the morning, urinate so much here. And when he takes off the diaper, put the diaper on a scale of those digital scales that are used for cooking. It can be a scale like this one, that he puts the diaper first dry, and then when he puts it on wet, subtract what the dry diaper weighed, and then what the wet diaper weighs, and write down at 11 in the morning, I take off the diaper, and the difference between wet and subtract what the dry diaper weighs, the diaper weighs 20 grams. Then, at the end of that day, because from 6 in the morning until 6 in the morning the next day, he will be able to total that. He will know that I drank 2 liters, I managed to urinate in the bathroom 1 liter 800, and the diaper, adding up all the times I took it off, weighed approximately 200 grams. He is going to notice that today, Sunday, next Sunday, he is going to do that measurement again. And why do we ask him to do these measurements in some more specific way? Because the patient just sees that he changes the diaper, but he's not able to notice these subtle differences, that before he weighed 200 that he urinated, and now he weighs 150 or he weighs 100. He is not able to see why he keeps changing 2 diapers a day. So the fact that he weighs the exact measurement and there may be small but significant changes in his improvement gives feedback to the patient that he is improving and that the exercises are working and will stimulate him to continue doing the exercises. I ask the patient to bring me all this information every 2 weeks, and we see the curves together so that he can see how he is improving and how these curves are improving. By looking at the curve, he can even more or less project that If he continues to do these exercises, he will be continent in how much time. So it is very important to somehow help in the measurement and in an objective quantification of how he is benefiting from the exercises for the recovery of urine control. So the message is that regular Kegel exercise is fundamental to regaining urinary control. The results are not immediate. It may take 4 to 6 weeks. You have to learn how to do the exercises. You have to verify that the patient is doing the exercises effectively. Sometimes we even use biofeedback. We place some electrodes, a transducer through the rectum, some electrodes around the anus, and we verify that the patient is doing the exercise properly. And as he contracts, he sees how the cursor in the different programs that are used to measure the pressure sensors lets the patient know if he is squeezing the right muscles and with the right intensity. And they do this as they go through different exercises, as the patient slowly relaxes or as the patient goes up and down quickly. And these exercises are done by the patient. They go to the office to do it. Today there are many of these devices that the patient can wear on an outpatient basis to help measure the pressure at which they are doing the exercises. Unfortunately, there are still no devices that help do the exercises for the patient. Some have been designed, and that is some of the things we are investigating, how to place and make electrodes that the patient at home can do the exercises for the patient. Because many times the patient gets tired, fatigued, and above all, when he does not see immediate results, he gets tired of doing the exercises. So if we can get these devices to do the exercises, as sometimes you put on electrodes that do the muscle contractions, if we can make the contractions of the muscles so that the patient can do these exercises, or the machine can stimulate the muscles and the patient does not have to be contracting them. These devices are available. They have been tried. They are placed inside the vagina or inside the rectum. Electrodes can also be made. But basically the ones that exist today are for pressure measurement, to measure if he is closing, if he is making the contraction of the perineal muscles in the right way. But once is basically for him to learn and see if he is doing it. But if during the medical consultation you really evaluate him, you take the time to explain to him what the exercises are. If he stands in front of a mirror and you ask him to contract his scrotum, he feels that he wants to move his penis. He feels that his testicles are coming up. Obviously, that is the way to verify that he is doing the exercises properly. The earlier you start doing the exercises, the faster you will recover urinary control if you have it. This complication is generally a temporary complication. Of course, it depends on the patient. It depends on the surgeon. It depends on the type of cancer. That is not what we are discussing. We are basically facing the reality that if you have urinary leakage, how to help you recover it in the fastest way. If after a certain period of time doing the therapy there has been no recovery, of course you will discuss with your doctor what additional alternatives there are, whether it's mesh placement or fistula placement, but most of them you do the exercises properly. You can regain urinary control by doing the exercises. So please share this material. I am sure it will be very helpful. This is a major health problem that affects men and women. We continue and see you in a new episode.